All right, let's dive into a world of medicine that is, well, almost too small to even imagine: microsurgery. Today, we're going to explore how this amazing combination of super clever mechanical tools and powerful AI is fixing a problem deep inside our body's most delicate plumbing. You know, it's a question most of us probably never even think about. Your body has this incredibly complex network of channels, this internal drainage system that just works. It keeps everything in balance. But what happens when that system gets blocked up? The results? Well, they can change your entire life. The condition is called lymphedema. Basically, it's this chronic, often really painful swelling that happens when your lymphatic system, that internal drainage network we were just talking about, can't do its job. Fluid starts to build up, which causes serious discomfort, makes it hard to move, and even raises the risk of some nasty infections. So that really gets us to the heart of the problem. You see, fixing these microscopic vessels isn't just hard, it's one of the toughest tests in all of surgery. The scale of it is just mind-boggling, and for the patient, the stakes couldn't be higher. And get this, one of the most common triggers for lymphedema is actually breast cancer treatment. It really shows you how connected everything in our body is. So surgery on the left side can sometimes put pressure on what's called the thoracic duct. You can think of it as the main superhighway for your body's entire drainage system. When that highway gets squeezed, you get a massive fluid traffic jam, leading to swelling that can even show up in the lower limbs. But this is where the story starts to get really exciting. Surgeons and engineers are coming up with these incredible new tools to take this challenge head on. We're talking about clever physical inventions that are totally changing the game in the operating room. And this just shows you what a huge leap forward we're talking about. So, the old way of reconnecting a tiny little vein involved painstakingly stitching it by hand with sutures. That process could take 20, even 30 minutes for just one connection. Now, with these new microclips, surgeons can make that same connection in just 4 to 5 minutes. I mean, think about that. That's a massive time saver. So how does it actually work? Well, one of these really cool new methods is called the triple clip technique. First, a surgeon puts in 3 guide sutures to hold the vessel open, kind of like tent poles. Then they just apply 3 specialized clips in the gaps between them. And the result? You get this perfectly rigid, triangular, and most importantly, super reliable connection. And it's all done in a fraction of the time. Of course, with this level of innovation, there's always a catch, right? The tools you need for this kind of ultra-delicate work, they're really on the cutting edge of technology. And that kind of tech, well, it comes with a pretty big price tag. I mean, just look at this. A single nano needle, which is absolutely essential for the most difficult lymph vessel repairs, can cost around $200 in Japan, but it's projected to be nearly $400 in a country like India, and that's for one needle. That cost can be a huge barrier to getting these life-changing surgeries to everyone who needs them. But the revolution isn't just about physical tools. Now we're seeing this powerful new ally joining the fight: artificial intelligence. AI is being used to look at the body's complex systems in ways we never could before, and it's finding patterns that are totally hidden from the human eye. Yeah, so what's happening is that AI algorithms are being fed all this data to map out the body's huge, sprawling network of lymphatic channels. It's almost like having a super-powered GPS for the body's plumbing, pointing out all these side roads and connections that surgeons might have completely missed otherwise. So what does this all mean? Well, AI gives us proof. This number here, a p-value of 0.0032, it might look pretty abstract, but it is a huge piece of evidence. By analyzing data from 51 patients, the AI found a statistically significant link between breast cancer and lymphedema. This isn't just a hunch anymore. It's a data-driven fact that helps doctors predict, diagnose, and treat the condition so much better. At the end of the day, all this tech is only as good as the results it gets for actual people. So let's take a look at the real-world impact these innovations are having on patients' lives. And the results are frankly incredible. In one center, surgeons did between 80 and 90 of these really complex free flap procedures using the new microclip technique. And the number of venous occlusions, we're talking dangerous blockages right at the connection site? 0. Not a single one. That is a perfect record and an amazing testament to how reliable this new method is. And if we look at a bigger study, the picture is still incredibly positive. Out of 51 lymphedema patients,
30% saw excellent improvement, and another 25% saw moderate improvement. So what that means is that a clear majority, more than half, of patients felt a real, significant, positive change in their condition because of these new approaches.
And what does excellent improvement really mean in real life? This quote, it just says it all. After one of these specialized surgeries, a patient's recovery was so dramatic that he was able to go back to his physically demanding job as a policeman. That's not just a medical statistic, that's giving somebody their life back. But as promising as all of this is, the work is far from over. There are still some pretty big hurdles to clear on the path to making lymphedema a condition we can treat for everyone, everywhere. And these hurdles are pretty substantial. We've already talked about the high cost of the tools. Then there's the need for specialized training. You have to make sure surgeons can master these incredibly delicate techniques. We also need to figure out how to handle the really complex, rare cases. And this one's critical. Before we can go fully sutureless, these methods need to be proven safe in extensive animal studies. So I think the big takeaway here is this. There's no single magic bullet. Real success in treating something as complicated as lymphedema, it takes a whole team approach. It demands a powerful combination of advanced technology, dedicated physical therapy, and, of course, the incredible skill of the surgical team. And that leaves us with a really fascinating final thought. We're seeing nanotechnology in the form of these amazing microtools and AI with its data analysis working together, hand in hand. So the question is, are we on the cusp of a new era? An era where we might finally be able to conquer chronic conditions that we once thought were untreatable. It's a future that might be closer than any of us think.